couple years ago, I saw this older infant, and she'd been sick for like a couple weeks before, like 2.5, 3 weeks, with fever, cough, runny nose. The fever had gotten better, but still persisting with the cough and the runny nose. And 2 or 3 days before they came in, the cough started to change and became like more persistent, having more of these episodes like cough, cough, vomit, and then just like really long episodes of coughing where mom didn't think the baby could catch their breath. And one of the episodes, they kind of turned a little bluish, and mom was very concerned. So she brought baby in, and the baby had one of these episodes right in front of me where they cough, 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 and like this big whoop. And I was like, ooh, you're vaccinated, right? And she was like, no, baby's never had any vaccines ever. And I was like, I am concerned you have pertussis, or the whooping cough, because that whoop is, that's why we call it the whooping cough. So I do the nose swab, and it is positive for Bordetella pertussis, or whooping cough. And so I went and I told the mom, and she's like, listen, I was Googling, and I read that there's an antibiotic treatment and that the baby's gonna get better. And I said, well, let's talk about that. There's a couple different phases of pertussis. So the first phase looks like a viral upper respiratory infection. The antibiotics are most effective during this phase. However, it's virtually indistinguishable from any other virus. The next phase, stage 2, is where we generally pick up that it's whooping cough, because they have these terrible coughing spells. But by that time, the antibiotic is really not that effective. We still give it, but it's not going to do that much to decrease the duration or severity, maybe a little bit. And then there's a third phase, which is the recovery phase. And I told mom, you kind of have to prepare yourself, because we're probably going to be coughing pretty similar to this for 4 to 6 to 10 weeks. And she was like, what? The mom was actually kind of funny, because she made this offhanded comment. She was like, gosh, I wish there was a way to prevent it. And I bit my tongue, and then she laughed and I laughed. And pertussis for teens and young adults, you can cough so hard that you pass out, that you pee yourself, that you vomit so much that you're losing weight, and even that you break ribs. The symptoms for infants, unfortunately, are even worse. They can cough so hard that they don't breathe, that they have seizures, that they vomit so much that they lose weight. They can actually have pneumonia and brain swelling, and unfortunately, the rate of death in under 1 and especially under 2 months is fairly high. Community vaccination rates are downtrending, and community pertussis rates are uptrending. This can be easily prevented with a vaccine, and it is recommended in every pregnancy, in your 3rd trimester, and at least every 10 years. Oh, and I absolutely was that mom who made sure that everyone who walked into my house when I had newborns had a Tdap and a flu shot, both updated for that year. It's okay to be the mama bear. Keeps your babies alive.